Question 1. When evaluating a situation where a patient's positioning is slightly suboptimal due to their condition, but proceeding with the current image acquisition would save significant time and avoid patient discomfort, what is the most appropriate course of action according to the principles of quality assurance in medical imaging as practiced in Canada? Option A. Acquire the suboptimal image and immediately flag it for the radiologist as having potential quality issues due to positioning. Option B. Skip the standard quality control checks for this specific image to expedite the process, given the patient's condition. Option C. Proceed with the suboptimal image acquisition to save time and minimize patient discomfort, assuming the radiologist can still interpret the diagnostic information. Option D. Attempt to reposition the patient to achieve optimal diagnostic quality, even if it requires more time and may cause some discomfort, ensuring the image meets established quality standards. Correct answer is D. Attempt to reposition the patient to achieve optimal diagnostic quality, even if it requires more time and may cause some discomfort, ensuring the image meets established quality standards. Explanation. This scenario presents a common challenge in medical imaging departments, balancing the need for efficient patient throughput with the imperative of maintaining high-quality diagnostic imaging. The technologist is faced with a situation where a deviation from standard protocol might save time, but could compromise image integrity and diagnostic accuracy. Careful judgment is required to uphold professional standards and patient safety. The correct approach emphasizes the technologist's responsibility to adhere to established quality assurance protocols. This aligns directly with the Canadian Association of Medical Radiation Technologists, CAMET, Code of Ethics and Professional Practice Standards, which mandate that technologists provide safe, competent, and ethical care. Maintaining image quality is a fundamental aspect of this, ensuring that diagnostic information is accurate and reliable for patient diagnosis and treatment. Adherence to established quality assurance procedures, including proper patient positioning, optimal exposure factors, and image processing, is paramount. An incorrect approach that prioritizes speed over established quality assurance procedures is professionally unacceptable. This could lead to suboptimal image quality, potentially resulting in misdiagnosis or the need for repeat examinations, which exposes the patient to unnecessary radiation and delays care. Such an approach would violate the CAMET commitment to patient well-being and the principles of ALARA, as low as reasonably achievable, by potentially increasing radiation dose without a corresponding diagnostic benefit. Furthermore, it undermines the integrity of the imaging department's quality assurance program, which is essential for accreditation and regulatory compliance. Another incorrect approach that involves bypassing established quality control checks before image submission is also professionally unsound. Quality control is an integral part of the imaging process, designed to catch potential errors before they impact patient care or diagnostic interpretation. Failing to perform these checks demonstrates a lack of diligence and a disregard for the established processes designed to ensure diagnostic accuracy. This can lead to the submission of images that do not meet diagnostic standards, impacting the radiologist's ability to provide an accurate report and potentially leading to adverse patient outcomes. The professional decision-making process in such situations should involve a clear understanding of the established quality assurance protocols and their rationale. The technologist must prioritize patient safety and diagnostic accuracy above all else. If a deviation from protocol is considered, it must be a deliberate, justified decision made in consultation with a supervisor or radiologist, and only if it demonstrably does not compromise image quality or patient safety. The technologist should always be prepared to explain their action and justify any deviations based on established professional standards and patient needs. Question 2. The risk matrix shows that the procedure performed on the patient has a moderate probability of inducing temporary skin reddening. The patient, a 45-year-old male, expresses concern about potential long-term health consequences and asks if the radiation dose received will cause him to develop cancer in the future. As a medical radiation technologist, how should you best address this patient's concern, considering the cellular response to radiation? Option A. Dismiss his concerns by stating that modern imaging equipment uses very low doses of radiation, and such effects are extremely rare. Option B. Inform the patient that any radiation exposure carries a risk of cancer, and it is impossible to predict the exact likelihood for his specific case. Option C. Explain that while temporary skin reddening is a possible deterministic effect directly related to the dose received is well below the threshold for significant long-term stochastic effects like cancer, and reassure him about the safety of the procedure. Option D. Advise the patient that the observed symptoms are likely unrelated to the radiation and suggest he consult a dermatologist for further evaluation. The correct answer is C. Explain that while temporary skin reddening is a possible deterministic effect directly related to the dose received is well below the threshold for significant long-term stochastic effects like cancer, and reassure him about the safety of the procedure. Explanation. Scenario analysis. This scenario presents a professional challenge for a medical radiation technologist, MRT, by requiring them to interpret and apply knowledge of cellular response to radiation in the context of patient care and safety, specifically concerning deterministic effects. The challenge lies in understanding the dose-response relationship for these effects and how it influences decisions regarding patient management and communication, all within the regulatory framework of the Canadian Association of Medical Radiation Technologists, CAMT. Accurate assessment and communication are paramount to ensure patient well-being and uphold professional standards. Correct approach analysis. The correct approach involves recognizing that deterministic effects, such as skin erythema or hair loss, are directly related to the radiation dose received and have a threshold dose. An MRT, understanding this cellular response, would prioritize informing the patient about potential temporary side effects that are directly linked to the radiation dose, emphasizing that these are expected and usually transient. This aligns with the CAMT ethical guidelines and professional practice standards, which mandate clear and accurate communication with patients about procedures and potential outcomes, promoting informed consent and patient autonomy. The focus is on managing patient expectations and providing appropriate reassurance based on scientific understanding of radiation biology. Incorrect approaches analysis. One incorrect approach would be to dismiss the patient's concern, stating that radiation doses are too low to cause any effects. This fails to acknowledge the possibility of deterministic effects, even at doses that might be considered low for some procedures, and disregards the patient's subjective experience and anxiety. It violates the ethical principle of beneficence by not adequately addressing potential patient harm or discomfort, and the CAMT expectation of empathetic and informative patient interaction. Another incorrect approach would be to overstate the risks and discuss potential long-term stochastic effects without clear evidence or context. While stochastic effects are a concern in radiation protection, focusing on them in response to a patient's observation of immediate or near-term effects is inappropriate and can cause undue alarm. This misrepresents the dose-response relationship for deterministic versus stochastic effects and deviates from providing accurate, relevant information, potentially breaching the CAMT standards for responsible communication and patient education. A further incorrect approach would be to suggest that the patient's observed symptoms are unrelated to the radiation exposure without further investigation or consideration of the known cellular responses to radiation. This prematurely dismisses a plausible cause and effect, potentially delaying appropriate patient management or reassurance. It neglects the MRT's responsibility to consider all relevant factors influencing patient well-being and to communicate potential radiation-induced effects accurately. Professional reasoning. When faced with a patient expressing concerns about potential radiation effects, an MRT should employ a decision-making process that prioritizes accurate, evidence-based communication and patient-centered care. This involves 1. Active listening, fully understanding the patient's concerns and observations. 2. Knowledge application, recalling and applying knowledge of radiation biology, specifically the dose-response relationships for deterministic and stochastic effects. 3. Risk assessment, evaluating the likelihood and nature of potential effects based on the procedure performed and the dose administered. 4. Clear communication, explaining potential outcomes in understandable terms, distinguishing between temporary deterministic effects and probabilistic stochastic effects, and managing patient expectations. 5. Adherence to professional standards, ensuring all communication and actions align with the ethical guidelines and practice standards set forth by the CAMT, prioritizing patient safety, autonomy, and well-being. Question 3. Operational review demonstrates a need to enhance understanding of radiation-induced damage at the molecular level to further optimize patient care and safety in diagnostic imaging. Which of the following approaches best reflects the MRT's professional responsibility in this context? Option A. Prioritizing the speed of image acquisition and patient throughput above all other considerations, including radiation dose optimization. Option B. Focusing on the direct impact of radiation on cellular DNA and the generation of free radicals, and applying this knowledge to refine imaging protocols for dose reduction while maintaining diagnostic efficacy. Option C. Delegating all concerns regarding radiation-induced damage to the radiologist or medical physicist without active engagement in mitigation strategies. Option D. Relying solely on established imaging protocols without considering individual patient variations or the underlying biological mechanisms of radiation damage. The correct answer is B. Focusing on the direct impact of radiation on cellular DNA and the generation of free radicals, and applying this knowledge to refine imaging protocols for dose reduction while maintaining diagnostic efficacy. Explanation. Scenario analysis. This scenario presents a professional challenge because it requires a medical radiation technologist, MRT, to interpret and apply complex scientific principles regarding radiation-induced damage at the molecular level within the context of patient care and safety. The challenge lies in translating abstract biological mechanisms into practical considerations for imaging procedures, ensuring that diagnostic benefit outweighs potential harm, and adhering to the Canadian Association of Medical Radiation Technologists, CAMET, Code of Ethics and Practice Standards. The MRT must balance the need for diagnostic information with the fundamental principle of minimizing radiation exposure and its associated risks, which are rooted in understanding how radiation interacts with biological molecules. Correct approach analysis. The correct approach emphasizes the MRT's responsibility to understand the fundamental mechanisms of radiation interaction with biological molecules, such as DNA damage and free radical formation, and how these relate to stochastic and deterministic effects. This understanding directly informs the optimization of imaging protocols to minimize dose while maintaining diagnostic image quality. By focusing on dose reduction techniques, appropriate shielding, and judicious use of imaging parameters, the MRT actively implements the ALARA, as low as reasonably achievable principle, a cornerstone of radiation safety, and a requirement implicitly supported by CAMET guidelines for responsible practice. This approach aligns with the CAMET commitment to patient safety and the ethical obligation to provide competent and safe care, grounded in scientific knowledge. Incorrect approaches analysis. One incorrect approach would be to solely rely on preset imaging protocols without critically evaluating their appropriateness for individual patient needs or considering potential molecular damage. This fails to uphold the principle of dose optimization and patient-specific care, potentially leading to unnecessary radiation exposure and increased risk of radiation-induced damage. It neglects the MRT's professional responsibility to adapt protocols based on their understanding of radiation biology. Another incorrect approach would be to prioritize image acquisition speed or convenience over radiation safety considerations. This directly contravenes the ALARA principle and the ethical duty to protect patients from harm. Ignoring the molecular basis of radiation damage, even if not explicitly stated in the protocol, can lead to practices that inadvertently increase risk. A third incorrect approach would be to dismiss concerns about radiation-induced damage as solely the responsibility of the radiologist or physicist, abdicating the MRT's role in patient protection. While collaboration is essential, the MRT is on the front line of radiation delivery and has a direct responsibility to understand and mitigate risks at the point of care, informed by their knowledge of radiation's effects. This failure to engage with the scientific underpinnings of radiation safety is a significant ethical and professional lapse. Professional reasoning. Professionals should approach situations involving radiation-induced damage by first recalling the fundamental principles of radiation biology and physics as they pertain to molecular interactions. This knowledge should then be applied to the specific imaging procedure, considering patient factors and the diagnostic objective. The decision-making process involves a continuous assessment of risk versus benefit, prioritizing dose optimization through protocol selection, modification, and the application of shielding and other protective measures. Adherence to CAMET standards, ethical codes, and regulatory requirements for radiation safety is paramount. When in doubt, consultation with senior colleagues, radiologists, or medical physicists is a crucial step in ensuring optimal patient care and safety. Question 4. Upon reviewing a requisition for a contrast-enhanced CT scan of the abdomen and pelvis for a patient presenting with acute abdominal pain, you note that the patient has a documented history of severe iodine allergy. The referring physician's note does not mention any specific precautions or alternative imaging modalities. What is the most appropriate course of action to ensure patient safety? Option A. Perform the CT scan without contrast and document that the contrast was omitted due to the patient's stated allergy. Option B. Immediately contact the referring physician to discuss the patient's iodine allergy and explore alternative imaging options or necessary precautions before proceeding with the examination. Option C. Inform the patient that you cannot perform the scan due to their allergy and ask them to return with a different order from their physician. Option D. Proceed with the contrast-enhanced CT scan as ordered, documenting the patient's stated allergy in the report, assuming the physician has considered it. The correct answer is B. Immediately contact the referring physician to discuss the patient's iodine allergy and explore alternative imaging options or necessary precautions before proceeding with the examination. Explanation. This scenario presents a common challenge in medical imaging where a patient's stated medical history conflicts with the imaging request, raising immediate patient safety concerns. The technologist must balance the physician's order with their professional responsibility to ensure patient well-being and adherence to established protocols. The core of the challenge lies in identifying and mitigating potential risks arising from an incomplete or inaccurate patient assessment. The correct approach prioritizes patient safety by directly addressing the discrepancy through established communication channels. This aligns with the Canadian Association of Medical Radiation Technologists, CAMET, Code of Ethics and Practice Standards, which emphasize the technologist's duty to advocate for the patient and ensure that imaging procedures are performed safely and appropriately. Specifically, it upholds the principle of informed consent and the technologist's responsibility to question orders that may pose a risk. By consulting with the referring physician, the technologist ensures that the imaging procedure is medically justified and that any potential contraindications or necessary precautions are identified and addressed, thereby preventing unnecessary radiation exposure or adverse events. An incorrect approach that proceeds with the imaging without clarification fails to uphold the technologist's professional duty of care. This could lead to patient harm if the patient has a contraindication to the requested contrast agent, or if the imaging is not medically indicated, resulting in unnecessary radiation exposure and potential financial burden. This directly violates the CAMET commitment to patient safety and the responsible use of ionizing radiation. Another incorrect approach, which involves proceeding with the imaging and documenting the patient's statement without further action, is also professionally unacceptable. While documentation is important, it does not mitigate the immediate risk. The technologist has a proactive responsibility to ensure patient safety, not merely to record potential risks. This approach neglects the ethical imperative to intervene when a patient's safety is potentially compromised. Finally, an incorrect approach that involves unilaterally refusing to perform the exam without attempting to resolve the discrepancy with the referring physician is also problematic. While the technologist has the right and responsibility to question orders, a complete refusal without communication can impede patient care and create unnecessary delays. The preferred professional approach involves collaborative problem-solving to ensure the patient receives appropriate and safe care. The professional decision-making process in such situations should involve a systematic approach. First, identify the potential safety concern. Second, consult relevant protocols and professional guidelines. Third, communicate directly with the referring physician to clarify the order and discuss any concerns. Fourth, document the communication and the resolution. And finally, proceed with the imaging only when patient safety is assured and the procedure is medically justified. Question 5. During the evaluation of a pediatric chest radiograph, what fundamental concept of radiation is most critical for the medical radiation technologist to prioritize to ensure both diagnostic quality and patient safety? Option A. The concept of photoelectric effect and Compton scattering, as understanding these interactions helps in optimizing image contrast and minimizing scatter radiation. Option B, the ALARA principle, guiding the technologist to use the lowest radiation dose that produces a diagnostically acceptable image. Option C, the inverse square law, as it dictates how radiation intensity decreases with distance from the source. Option D, the principle of justification, ensuring the examination is medically necessary and provides a benefit that outweighs the radiation risk. The correct answer is C, the inverse square law, as it dictates how radiation intensity decreases with distance from the source. Explanation: scenario analysis. This scenario is professionally challenging because it requires the medical radiation technologist, MRT, to apply fundamental concepts of radiation safety in a practical, patient-centered context. The challenge lies in balancing the diagnostic benefit of imaging with the ALARA, as low as reasonably achievable, principle, ensuring patient and public safety without compromising image quality. Misapplication of these concepts can lead to unnecessary radiation exposure, impacting patient outcomes and potentially violating regulatory standards. Correct approach analysis. The correct approach involves a thorough understanding of radiation physics and its biological effects, coupled with the application of established safety principles. This includes selecting appropriate imaging parameters, KVP, as filtration, utilizing collimation effectively, and employing shielding when indicated, all within the framework of the Canadian Association of Medical Radiation Technologists, CAMET, Code of Ethics and relevant provincial/federal radiation safety regulations. This approach prioritizes patient well-being by minimizing dose while ensuring diagnostic efficacy, aligning with the professional and ethical obligations of an MRT. It demonstrates a commitment to the ALARA principle, a cornerstone of radiation protection. Incorrect approaches analysis. One incorrect approach would be to solely focus on obtaining the clearest image without considering the radiation dose delivered. This fails to adhere to the ALARA principle and could result in unnecessary exposure, violating ethical obligations and regulatory requirements for dose optimization. Another incorrect approach is to indiscriminately reduce all exposure factors to the absolute minimum, without regard for diagnostic image quality. This can lead to suboptimal images, requiring repeat examinations, which ultimately increases the cumulative radiation dose to the patient and may not provide the necessary diagnostic information, thus failing to meet the primary objective of the examination and potentially violating the principle of justification for the procedure. A third incorrect approach is to neglect the use of appropriate shielding or collimation when not explicitly instructed by a physician. This demonstrates a lack of proactive radiation safety awareness and a failure to uphold the MRT's responsibility to minimize dose to all individuals, including themselves and others in the vicinity, as mandated by radiation safety legislation. Professional reasoning. Professionals should approach such situations by first identifying the diagnostic objective of the examination. They must then consider the fundamental principles of radiation protection, including time, distance, and shielding, and how these apply to the specific imaging modality and patient. This involves critically evaluating imaging parameters, understanding the relationship between dose and image quality, and applying collimation and shielding judiciously. Decision-making should be guided by the CAMET Code of Ethics, provincial/federal radiation safety legislation, and established best practices, always prioritizing patient safety and diagnostic efficacy. Regular professional development and staying abreast of evolving guidelines are crucial for maintaining competence in applying these fundamental concepts. Question 6. Strategic planning requires medical radiation technologists to consider the long-term implications of radiation exposure. When evaluating the risk assessment and epidemiology of radiation exposure in a patient population undergoing frequent diagnostic imaging, which approach best aligns with the regulatory framework and ethical obligations of the Canadian Association of Medical Radiation Technologists? Option A. Prioritizing the minimization of cumulative radiation dose for individuals by implementing dose reduction techniques and reviewing imaging protocols based on current epidemiological data regarding stochastic effects. Option B. Focusing solely on the immediate diagnostic yield of each imaging procedure, assuming individual risks are negligible for single exposures. Option C. Advocating for the cessation of all imaging procedures that utilize ionizing radiation due to the inherent risks, regardless of diagnostic necessity. Option D. Relying on anecdotal evidence from colleagues regarding radiation effects rather than established epidemiological studies. The correct answer is A. Prioritizing the minimization of cumulative radiation dose for individuals by implementing dose reduction techniques and reviewing imaging protocols based on current epidemiological data regarding stochastic effects. Explanation: this scenario is professionally challenging because it requires a medical radiation technologist, MRT, to balance the immediate need for diagnostic imaging with the long-term implications of radiation exposure on patient populations. The Canadian Association of Medical Radiation Technologists, CAMT, regulatory framework emphasizes the ALARA as low as reasonably achievable principle, which is rooted in the fundamental understanding of radiation risk and epidemiology. Effective strategic planning in this context involves not just current practice, but also foresight into potential cumulative effects and the ethical responsibility to minimize harm. The correct approach represents best professional practice because it directly aligns with the CAMT commitment to patient safety and the responsible use of ionizing radiation. By focusing on established epidemiological data and risk assessment models, an MRT can proactively identify and mitigate potential risks associated with specific imaging procedures or patient groups. This proactive stance is ethically mandated by the principle of non-maleficence and is supported by regulatory guidelines that encourage continuous quality improvement and evidence-based practice. Understanding the dose-response relationship and the stochastic nature of radiation effects allows for informed decision-making that prioritizes patient well-being over time. An incorrect approach that relies solely on immediate diagnostic necessity without considering epidemiological risk factors would fail to uphold the ALARA principle. This oversight could lead to unnecessary cumulative radiation doses for patients, increasing their lifetime risk of radiation-induced harm, which is a direct contravention of ethical obligations and regulatory expectations. Another incorrect approach that dismisses the relevance of epidemiological data because individual risks appear low for a single exposure overlooks the collective impact of repeated exposures across a population, core concept in radiation epidemiology and public health. Furthermore, an approach that prioritizes cost efficiency over thorough risk assessment would be ethically unsound and potentially non-compliant with regulations that mandate appropriate resource allocation for patient safety. Professionals should employ a decision-making framework that integrates current clinical needs with a comprehensive understanding of radiation epidemiology. This involves consulting relevant scientific literature, utilizing dose monitoring tools, engaging in peer review of imaging protocols, and participating in ongoing professional development related to radiation safety and risk assessment. When faced with a decision, an MRT should ask, does this imaging procedure, considering the patient's history and the potential for future exposures, adhere to the ALARA principle based on current epidemiological understanding of radiation risks? This systematic evaluation ensures that both immediate diagnostic goals and long-term patient health are adequately addressed. Question 7. Consider a scenario where a patient presents with acute shortness of breath and suspected pulmonary edema, requiring chest imaging. The patient is visibly distressed and has difficulty maintaining any position for an extended period. Which of the following approaches best demonstrates an understanding of the human body systems relevant to medical imaging in this context? Option A. Proceed with a portable AP supine chest X-ray without further patient assessment or consultation, assuming this is the most expedient method for a dyspneic patient. Option B. Prioritize obtaining a technically perfect image by instructing the patient to assume a specific, potentially uncomfortable, lateral decubitus position to best visualize fluid accumulation, regardless of their ability to tolerate it. Option C. Assess the patient's respiratory and cardiovascular status. Consider alternative positioning that facilitates easier breathing while still achieving diagnostic quality images, e.g., slight lordotic or semi-erect AP, and consult with the referring physician or radiologist regarding the most appropriate imaging strategy given the patient's condition. Option D. Position the patient in a standard erect AP projection, instructing them to hold their breath for the shortest possible duration to minimize discomfort, and proceed with the imaging sequence. Correct answer is D. Position the patient in a standard erect AP projection, instructing them to hold their breath for the shortest possible duration to minimize discomfort, and proceed with the imaging sequence. Explanation. Scenario analysis. This scenario is professionally challenging because it requires the medical radiation technologist, MRT, to integrate knowledge of complex human anatomy and physiology with the practical demands of imaging procedures. The patient's condition, involving potential compromise of multiple organ systems, necessitates a nuanced understanding of how these systems interact and how imaging techniques can best visualize them without exacerbating the patient's distress or compromising diagnostic accuracy. The MRT must make rapid, informed decisions about positioning, technique, and potential modifications to the standard protocol, all while prioritizing patient safety and comfort, which are paramount under the Canadian Association of Medical Radiation Technologists, CAMET, Code of Ethics and Practice Standards. Correct approach analysis. The correct approach involves a systematic assessment of the patient's presenting condition and a thorough understanding of the relevant human body systems. This includes recognizing how the respiratory and cardiovascular systems are interconnected and how their compromise can affect other organs, such as the brain and kidneys. The MRT must then apply this knowledge to select imaging parameters and patient positioning that will yield the clearest diagnostic images while minimizing physiological stress. This aligns with the CAMET emphasis on competent practice, patient-centered care, and the application of evidence-based knowledge. Specifically, understanding the impact of positioning on diaphragmatic excursion and venous return is critical for optimizing chest imaging in a compromised patient. Similarly, awareness of the renal system's sensitivity to blood pressure fluctuations and contrast media is vital for abdominal imaging. This approach demonstrates a commitment to professional accountability and the highest standards of patient care as outlined in CAMET guidelines. Incorrect approaches analysis. One incorrect approach would be to proceed with a standard imaging protocol without considering the patient's specific physiological status. This fails to acknowledge the interconnectedness of body systems and the potential for standard protocols to be detrimental to a critically ill patient. Ethically, this could be considered a breach of the duty of care, as it prioritizes routine over individualized patient needs, potentially leading to adverse outcomes. Another incorrect approach would be to solely focus on obtaining diagnostic images without adequate consideration for patient comfort and physiological stability. For instance, forcing a position that severely restricts breathing or circulation, even if it theoretically offers a better view of a specific organ, would be professionally unacceptable. This disregards the CAMET ethical imperative to minimize harm and suffering. A third incorrect approach would be to make assumptions about the patient's condition without consulting available clinical information or seeking clarification from the referring physician or other healthcare professionals. This demonstrates a lack of due diligence and a failure to engage in collaborative patient care, which is a cornerstone of effective healthcare delivery and is implicitly supported by CAMET standards promoting interprofessional communication. Professional reasoning. Professionals facing such a scenario should employ a decision-making process that begins with a comprehensive review of the patient's medical history and current clinical presentation. This should be followed by a thorough assessment of the patient's physiological status, paying close attention to vital signs and any signs of distress. The MRT should then consider the specific diagnostic questions being asked and how different imaging modalities and techniques can best answer them while respecting the patient's limitations. Consultation with the referring physician or radiologist is crucial to ensure the imaging plan is appropriate and safe. Throughout the procedure, continuous monitoring of the patient's condition and a willingness to adapt the protocol as needed are essential. This iterative process of assessment, planning, execution, and reassessment, guided by ethical principles and professional standards, ensures optimal patient care. Question 8. The review process indicates a need to assess the technologist's understanding of how radiation therapy impacts biological tissues at a cellular and molecular level, and how this understanding informs treatment decisions. Considering the principles of radiobiology, which of the following best reflects the technologist's role in optimizing treatment outcomes and minimizing adverse effects? Option A. Relying on historical treatment data and personal experience from previous cases to guide treatment decisions, without necessarily delving into the underlying radiobiological mechanisms. Option B. Prioritizing patient comfort and minimizing any perceived discomfort during treatment, even if it means deviating from the prescribed dose or fractionation schedule to avoid potential acute side effects. Option C. Recognizing that different tissues have varying sensitivities to radiation based on their cell cycle kinetics and repair capabilities, and using this knowledge to anticipate potential normal tissue reactions and inform treatment planning adjustments in consultation with the radiation oncologist. Option D. Focusing primarily on the precise delivery of the prescribed physical dose and energy to the target volume, assuming that adherence to the physical parameters will automatically lead to optimal biological outcomes. The correct answer is C. Recognizing that different tissues have varying sensitivities to radiation based on their cell cycle kinetics and repair capabilities, and using this knowledge to anticipate potential normal tissue reactions and inform treatment planning adjustments in consultation with the radiation oncologist. Explanation. The review process indicates a need to evaluate the understanding of radiation therapy's biological basis and its practical application within the Canadian Association of Medical Radiation Technologists (CAMT) regulatory framework. This scenario is professionally challenging because it requires the technologist to move beyond simply administering a prescribed dose to understanding the underlying biological mechanisms that dictate treatment efficacy and patient safety. Accurate interpretation of these principles is crucial for optimizing treatment outcomes and minimizing adverse effects, directly impacting patient care, and aligning with CAMT commitment to professional competence and patient well-being. The correct approach represents best professional practice because it demonstrates a comprehensive understanding of radiobiology, specifically the relationship between radiation dose, fractionation, and tissue response. This understanding allows the technologist to anticipate potential biological consequences, such as normal tissue complication probabilities, NTCP, and tumor control probabilities, TCP, and to communicate effectively with the radiation oncologist regarding treatment planning and delivery. Adherence to CAMT standards of practice and guidelines for professional conduct, which emphasize evidence-based practice and patient-centered care, necessitates this level of biological comprehension. An incorrect approach that focuses solely on the physical aspects of radiation delivery, such as dose and energy, fails to acknowledge the biological impact of that radiation. This oversight can lead to suboptimal treatment planning, potentially resulting in underdosing tumors or overexposing critical normal tissues, thereby violating the ethical obligation to provide safe and effective care as mandated by CAMT. Another incorrect approach that prioritizes patient comfort above all else, without considering the biological imperative of achieving tumor control, could lead to insufficient radiation doses, compromising treatment efficacy, and failing to meet the standard of care. A third incorrect approach that relies on anecdotal evidence or personal experience rather than established radiobiological principles demonstrates a lack of commitment to continuous learning and evidence-based practice, which is a cornerstone of professional responsibility under CAMT guidelines. Professionals should approach such situations by first identifying the core biological principles at play, such as the linear quadratic model, the concept of biologically effective dose, BED, and the different sensitivities of rapidly dividing versus slowly dividing tissues. They should then consider how these principles inform treatment decisions, including dose escalation, fractionation schedules, and the management of treatment-related toxicities. Finally, they must integrate this biological understanding with the specific clinical context, patient factors, and the established standards of practice and ethical guidelines set forth by the CAMT. Question 9. Which approach would be most effective in ensuring radiation protection guidelines are met for a new diagnostic imaging protocol, considering both patient and occupational safety? Option A. Prioritizing rapid implementation of the new protocol to meet clinical demand, with risk assessment conducted later. Option B. Focusing solely on patient dose reduction, assuming staff exposure will be adequately managed by general safety practices. Option C. Relying on established protocols from similar procedures without specific evaluation for the new protocol. Option D. conducting a thorough risk assessment that considers potential radiation doses, patient factors, and necessary protective measures for both patients and staff. The correct answer is D. Conducting a thorough risk assessment that considers potential radiation doses, patient factors, and necessary protective measures for both patients and staff. Explanation. This scenario presents a common challenge in medical radiation technology, balancing the need for diagnostic imaging with the imperative of minimizing radiation exposure to both patients and staff, adhering to the ALARA principle. The professional challenge lies in accurately assessing the potential risks associated with a specific imaging procedure and selecting the most appropriate radiation protection strategy without compromising diagnostic quality. Careful judgment is required to ensure that protective measures are effective and justifiable. The correct approach, focusing on a comprehensive risk assessment, represents best professional practice because it directly aligns with the fundamental principles of radiation protection as outlined by regulatory bodies and professional associations in Canada, including the Canadian Association of Medical Radiation Technologists, CAMT. This approach involves systematically identifying potential hazards, evaluating the likelihood and severity of harm, and implementing controls to reduce risks to an acceptable level. It is a proactive and evidence-based method that ensures all relevant factors are considered, from patient-specific characteristics to equipment performance and environmental conditions. This aligns with the ethical obligation to provide safe and effective care. An incorrect approach that relies solely on historical practice, without reevaluation, fails to acknowledge that radiation protection guidelines and technologies evolve. This could lead to suboptimal protection, potentially exposing individuals to unnecessary radiation, which is a regulatory and ethical failure. Another incorrect approach that prioritizes speed over thoroughness in risk assessment might overlook critical factors, leading to inadequate protection measures and a breach of professional duty of care. Furthermore, an approach that focuses exclusively on patient protection while neglecting staff protection would be incomplete, as occupational radiation safety is also a key regulatory requirement. The professional decision-making process for similar situations should involve a systematic review of the imaging procedure, considering factors such as the type of examination, the patient's age and condition, the equipment being used, and the specific imaging parameters. This should be followed by an evaluation of potential radiation doses to both the patient and personnel. Based on this assessment, appropriate protective measures, such as shielding, collimation, and optimized exposure factors, should be selected and implemented. Continuous learning and staying updated on current best practices and regulatory requirements are crucial for maintaining a high standard of radiation protection. Question 10. The evaluation methodology shows that a patient undergoing a diagnostic imaging procedure received a specific radiation dose. Considering the principles of radiation protection and risk assessment as applied in Canadian medical radiation practice, which approach best reflects the MRT's professional responsibility in managing this situation? Option A. Focusing solely on achieving the absolute lowest radiation dose possible, regardless of its impact on image quality and diagnostic efficacy. Option B. Conducting a comprehensive risk assessment that weighs the diagnostic benefit against the potential radiation risk to the patient, considering individual factors and optimizing dose where possible. Option C. Confirming the measured dose is within established diagnostic reference levels and proceeding without further consideration. Option D. Prioritizing patient comfort and procedure efficiency, accepting the measured dose as adequate for diagnostic purposes. The correct answer is C. Confirming the measured dose is within established diagnostic reference levels and proceeding without further consideration. Explanation. Scenario analysis. This scenario presents a professional challenge for a medical radiation technologist, MRT, in Canada, requiring them to interpret and apply radiation dose and measurement principles within the context of risk assessment for a patient undergoing a diagnostic imaging procedure. The challenge lies in moving beyond simple measurement to a qualitative and quantitative evaluation of potential harm versus benefit, a core responsibility in radiation protection. The MRT must consider not only the measured dose, but also the implications of that dose in relation to the patient's specific circumstances and the diagnostic objective. This necessitates a nuanced understanding of the ALARA principle and its practical application in a clinical setting, as mandated by Canadian regulatory frameworks governing medical radiation. Correct approach analysis. The correct approach involves a comprehensive risk assessment that considers the patient's individual factors, the diagnostic benefit of the procedure, and the measured radiation dose. This aligns with the fundamental principles of radiation protection as outlined by Health Canada and provincial regulatory bodies, which emphasize the ALARA as low as reasonably achievable principle. A thorough risk assessment allows the MRT to determine if the potential diagnostic information gained outweighs the radiation risk to the patient. It also informs decisions about optimizing imaging parameters to minimize dose while maintaining diagnostic image quality, thereby fulfilling their ethical and professional obligations to patient safety. This approach is grounded in the understanding that radiation dose is not an absolute measure of risk, but must be contextualized. Incorrect approach is analysis. One incorrect approach would be to solely focus on achieving the lowest possible radiation dose without considering the diagnostic efficacy of the procedure. This fails to acknowledge that diagnostic imaging is intended to provide valuable clinical information, and an excessively low dose might compromise image quality to the point where the diagnostic benefit is negated, potentially leading to repeat procedures or misdiagnosis. This violates the principle of diagnostic benefit and can be seen as a failure to adhere to the ALARA principle in its entirety, as it prioritizes dose reduction over the intended clinical outcome. Another incorrect approach would be to accept the measured dose as inherently safe without any further evaluation, assuming that any dose within established diagnostic reference levels, DRL, is acceptable. This overlooks the importance of individual patient risk factors and the specific clinical context. While DRLs provide a benchmark, they are not absolute limits for all patients, and a responsible MRT must consider whether a particular patient's circumstances warrant further dose optimization. This approach represents a passive acceptance of dose rather than an active, risk-informed decision-making process, which is a regulatory and ethical expectation. A third incorrect approach would be to prioritize patient comfort or procedure speed over accurate dose measurement and assessment. While patient comfort is important, it should not supersede the fundamental responsibility of ensuring radiation safety. Similarly, while efficiency is valued, it cannot come at the expense of a thorough risk assessment. This approach demonstrates a disregard for the established protocols for radiation protection and measurement, potentially exposing the patient to unnecessary or unassessed radiation risk. Professional reasoning. Professionals should approach radiation dose and measurement through a systematic risk assessment framework. This involves 1. Understanding the clinical indication for the procedure and the potential diagnostic benefit. 2. Identifying patient-specific factors that might influence radiation sensitivity or risk, e.g., age, pregnancy, medical history. 3. Accurately measuring or estimating the radiation dose delivered using appropriate instrumentation and techniques. 4. Evaluating the measured dose in the context of the diagnostic benefit and patient-specific risks, applying the ALARA principle. 5. Documenting the assessment and any dose optimization strategies employed. This structured approach ensures that decisions are evidence-based, ethically sound, and in compliance with Canadian regulatory requirements for medical radiation safety. Question 11. The assessment process reveals that a medical radiation technologist is preparing to perform a diagnostic imaging examination of the pelvic region. Considering the varying radiosensitivity of different human tissues, which of the following approaches best reflects the technologist's professional responsibility in optimizing radiation dose while ensuring diagnostic image quality? Option A. Employ a broad collimation field to capture all potential anatomical structures within the pelvic area, assuming this will provide more comprehensive diagnostic information. Option B. Utilize a standardized imaging protocol for all pelvic examinations, ensuring consistent image acquisition regardless of minor variations in patient anatomy. Option C. Adjust imaging parameters and collimation to minimize radiation exposure to radiosensitive tissues within the pelvic region, such as the gonads and bone marrow, while still achieving diagnostic image quality. Option D. Prioritize image acquisition speed by using the highest available EMA setting to reduce patient scan time, even if it means slightly increasing overall radiation output. The correct answer is B. Utilize a standardized imaging protocol for all pelvic examinations, ensuring consistent image acquisition regardless of minor variations in patient anatomy. Explanation. The assessment process reveals a common challenge in medical radiation technology, ensuring patient safety and diagnostic image quality while minimizing radiation dose, particularly when considering the varying radiosensitivity of different tissues. This scenario is professionally challenging because it requires the technologists to apply their knowledge of radiation biology to practical imaging protocols, balancing the need for diagnostic information with the principle of ALARA, as low as reasonably achievable. The technologist must make informed decisions about imaging parameters and patient positioning based on the specific anatomical region being examined and the known radiosensitivity of the tissues within that region. The correct approach represents best professional practice because it directly addresses the core principle of radiation protection by prioritizing the minimization of dose to the most radiosensitive tissues. This aligns with the ethical and regulatory obligations of medical radiation technologists in Canada, as outlined by the Canadian Association of Medical Radiation Technologists, CAMT, and relevant provincial regulatory bodies. By selecting imaging parameters that are appropriate for the specific tissue sensitivity and anatomical location, the technologist ensures that diagnostic information is obtained with the lowest possible radiation exposure, thereby protecting the patient from unnecessary stochastic and deterministic effects. This demonstrates a commitment to patient well-being and adherence to professional standards of care. An incorrect approach that fails to consider tissue radiosensitivity would be professionally unacceptable due to specific regulatory and ethical failures. For instance, applying a standardized high-dose protocol to all examinations regardless of the anatomical site or tissue composition would violate the ALARA principle. This could lead to overexposure of radiosensitive tissues, increasing the risk of deterministic effects, like skin erythema in high doses, or stochastic effects, like an increased lifetime risk of cancer. Such a practice would contravene the CAMT Code of Ethics and Professional Conduct, which emphasizes patient safety and the responsible use of radiation. Furthermore, it would likely fall short of provincial regulatory requirements for radiation safety and quality assurance in diagnostic imaging. Another incorrect approach might involve prioritizing image acquisition speed or convenience over dose optimization, which again disregards the fundamental responsibility to protect the patient from unnecessary radiation. This demonstrates a lack of critical thinking and a failure to integrate knowledge of radiation biology into clinical practice, potentially leading to suboptimal patient outcomes and professional misconduct. The professional decision-making process for similar situations should involve a systematic evaluation of the imaging request, the patient's clinical history, and the anatomical region of interest. The technologist should then consult established imaging protocols and guidelines, considering the known radiosensitivity of the tissues involved. This includes understanding which tissues, e.g., gonads, lens of the eye, thyroid, bone marrow, are more susceptible to radiation damage and adjusting imaging parameters, KVP, as filtration, collimation accordingly. If a specific protocol is not readily available or requires adaptation, the technologist should exercise professional judgment, informed by their understanding of radiation physics and biology, to achieve the best possible diagnostic image with the lowest achievable dose. Collaboration with radiologists and senior technologists can also be a valuable part of this decision-making process, especially in complex or unusual cases. Question 12. The investigation demonstrates that a patient requires imaging of a dense bone structure. Two imaging modalities are available, one utilizing lower-energy X-rays with a higher probability of photoelectric absorption, and another employing higher-energy gamma rays with a greater prevalence of Compton scattering. Considering the principles of radiation interaction with matter and the CAMT regulatory framework, which approach best aligns with professional practice for optimizing diagnostic yield while minimizing patient dose? Option A. Select the modality with higher energy gamma rays, as Compton scattering generally produces more scatter radiation which can be managed with collimation and shielding, ensuring a clearer image of dense bone. Option B. Choose the modality that has historically been used for similar examinations, without further investigation into the specific radiation interaction characteristics of each option. Option C. Select the modality utilizing lower energy X-rays, as the increased photoelectric absorption in dense bone will provide better contrast for visualizing fine details, and lower energy photons generally result in lower patient dose for equivalent diagnostic information. Option D. Prioritize the modality that offers the fastest image acquisition time, as patient comfort and throughput are paramount in diagnostic imaging. The correct answer is A. Select the modality with higher energy gamma rays, as Compton scattering generally produces more scatter radiation which can be managed with collimation and shielding, ensuring a clearer image of dense bone. Explanation. The investigation demonstrates a scenario where a medical radiation technologist, MRT, is presented with two distinct imaging modalities for a patient requiring a diagnostic examination. The challenge lies in selecting the modality that best balances diagnostic efficacy with patient safety, considering the fundamental principles of radiation interaction with matter. This requires a deep understanding of how different radiation types interact with biological tissues and the implications for dose and image quality, all within the regulatory framework of the Canadian Association of Medical Radiation Technologists, CAMT. The correct approach involves a comparative analysis of the radiation interactions inherent to each modality. This means evaluating how X-rays interact via photoelectric effect in Compton scattering, and how gamma rays from a radionuclide interact. The technologist must consider which interaction mechanisms are more prevalent in the specific tissues being imaged, and how these interactions contribute to the diagnostic information obtained versus the potential for biological harm. Best professional practice, guided by CAMT standards and the principles of ALARA, as low as reasonably achievable, mandates choosing the modality that provides the necessary diagnostic information with the lowest possible radiation dose. This involves understanding that photoelectric absorption is more significant in high atomic number tissues and at lower energies, contributing to contrast, while Compton scattering is more prevalent in soft tissues and at higher energies, contributing to scatter radiation and dose. An incorrect approach would be to select a modality based solely on perceived image clarity, without considering the underlying radiation physics and dose implications. For instance, choosing a modality that relies on higher energy photons without understanding how this increases Compton scatter, potentially degrading image quality and increasing patient dose, would be a failure. Another incorrect approach would be to prioritize speed of acquisition over a thorough understanding of radiation interaction, leading to suboptimal technique selection. Ethically, this would violate the duty of care to the patient. Regulatory failures would include not adhering to established dose optimization protocols and potentially contravening guidelines set forth by regulatory bodies that govern the practice of medical radiation technology in Canada, which emphasize patient safety and effective dose management. Professionals should employ a decision-making framework that begins with a clear understanding of the clinical indication for the examination. This is followed by an assessment of the available imaging modalities and their respective radiation interaction characteristics. The technologist must then critically evaluate how these interactions will affect image quality and patient dose for the specific anatomical region. Finally, the decision should be made in consultation with the referring physician if uncertainty exists, always prioritizing the ALARA principle and adhering to CAMT practice standards. Question 13. The monitoring system demonstrates that a patient presenting with a suspected complex fracture of the distal tibia and fibula with potential soft tissue compromise has undergone imaging. The referring physician's request specifies visualization of the fracture pattern and assessment of surrounding soft tissues. Considering the CAMT guidelines on imaging techniques for specific anatomical regions and the principle of diagnostic efficacy balanced with radiation safety, which of the following approaches would be considered the most appropriate initial imaging strategy? Option A. Perform standard anterior-posterior and lateral radiographs of the distal tibia and fibula, followed by a CT scan of the same region if the radiographs are inconclusive or if further detail of the bone fragments is required. Option B. Conduct an ultrasound examination of the distal tibia and fibula, focusing on superficial soft tissue assessment and any palpable bony irregularities. Option C. Immediately proceed with a magnetic resonance imaging, MRI, examination of the distal tibia and fibula to comprehensively assess both bone and soft tissue structures. Option D. Obtain a single computed tomography, CT, scan of the distal tibia and fibula, utilizing a protocol optimized for bony detail and soft tissue contrast. The correct answer is A. Perform standard anterior, posterior, and lateral radiographs of the distal tibia and fibula, followed by a CT scan of the same region if the radiographs are inconclusive or if further detail of the bone fragments is required. Explanation: this scenario presents a professional challenge for a medical radiation technologist, MRT, in Canada, specifically concerning the implementation of imaging techniques for a patient with a suspected complex fracture of the distal tibia and fibula. The challenge lies in selecting the most appropriate imaging modality and protocol to accurately visualize the fracture pattern, assess soft tissue involvement, and minimize radiation dose, all while adhering to the standards of practice set by the Canadian Association of Medical Radiation Technologists, CAMET, and relevant provincial regulatory bodies. Careful judgment is required to balance diagnostic efficacy with patient safety and resource utilization. The correct approach represents best professional practice because it prioritizes diagnostic accuracy and patient well-being through a systematic and evidence-based selection of imaging techniques. It aligns with the CAMET commitment to quality patient care and the ethical obligations of MRTs to utilize their knowledge and skills effectively. This approach demonstrates an understanding of the specific anatomical region, the nature of the suspected pathology, and the capabilities and limitations of various imaging modalities. An incorrect approach that relies solely on a single, potentially suboptimal imaging modality, without considering alternatives or patient-specific factors, would represent a failure to meet the standard of care. For instance, choosing a technique that does not adequately visualize the suspected fracture complexity or soft tissue injury would compromise diagnostic integrity. Another failure would be to select a protocol that delivers an unnecessarily high radiation dose without a clear clinical justification, violating the ALARA as low as reasonably achievable principle, which is a cornerstone of radiation safety in Canada. Furthermore, neglecting to consult with the referring physician or radiologist regarding the most appropriate imaging strategy would be a breach of professional communication and collaboration standards. Professionals should employ a decision-making framework that begins with a thorough review of the patient's clinical history and the referring physician's request. This should be followed by an assessment of the suspected pathology and the anatomical region. MRTs should then consider the diagnostic capabilities of available imaging modalities, e.g., X-ray, CT, MRI, ultrasound, in relation to the clinical question. They must also factor in patient-specific considerations such as contraindications, allergies, and the need for contrast agents. Consultation with radiologists and senior colleagues is crucial for complex cases. Finally, the chosen imaging protocol must be optimized for diagnostic yield while adhering to radiation safety principles and institutional policies. Question 14. Performance analysis shows that Technologist is encountering significant difficulty obtaining diagnostic quality ultrasound images of the gallbladder due to patient body habitus and limited patient mobility, resulting in significant shadowing and poor visualization of posterior structures. Which of the following represents the most appropriate and professionally responsible course of action? Option A. Apply increased transducer pressure and instruct the patient to hold their breath for extended periods to force better visualization, regardless of patient comfort. Option B. Immediately terminate the examination due to the patient's inability to cooperate with positioning, citing patient limitations as the reason for incomplete study. Option C. Systematically adjust transducer manipulation, explore alternative acoustic windows, and optimize imaging parameters such as gain, depth, and focus to improve image penetration and visualization. Option D. Proceed with the examination, acquiring the best possible images despite the significant shadowing and poor visualization, and document the limitations. The correct answer is C. Systematically adjust transducer manipulation, explore alternative acoustic windows, and optimize imaging parameters such as gain, depth, and focus to improve image penetration and visualization. Explanation: scenario analysis. This scenario presents a common challenge in diagnostic ultrasound where image quality is compromised by patient factors, requiring the technologist to balance diagnostic necessity with patient comfort and safety. The technologist must apply their understanding of ultrasound physics to optimize image acquisition, while adhering to professional standards and regulatory guidelines set by the Canadian Association of Medical Radiation Technologists. CAMET. The challenge lies in making an informed decision about how to proceed when initial attempts to obtain diagnostic images are unsuccessful due to patient positioning or physiological limitations, without compromising the integrity of the examination or patient well-being. Correct approach analysis. The correct approach involves a systematic, physics-informed strategy to overcome imaging challenges. This includes adjusting transducer manipulation, exploring different acoustic windows, and modifying imaging parameters, e.g., gain, depth, focus, based on an understanding of how sound waves interact with tissues. This aligns with the CAMET emphasis on competent practice, requiring technologists to utilize their knowledge to achieve diagnostic quality images. It also reflects ethical considerations of patient care, ensuring the examination is performed to the best of the technologist's ability while respecting the patient's limitations. This approach prioritizes obtaining a diagnostically useful image through technical skill and knowledge, which is the primary goal of the examination. Incorrect approach is analysis. One incorrect approach involves proceeding with suboptimal images without further attempts to improve quality. This fails to meet the CAMET standards for diagnostic imaging, as the images may not be interpretable or could lead to misdiagnosis. Ethically, it represents a failure to provide competent care. Another incorrect approach is to immediately terminate the examination due to minor patient discomfort or difficulty in positioning, without exhausting all reasonable technical adjustments. This could be seen as a failure to uphold the professional obligation to perform the examination to the best of one's ability, and may not align with the referring physician's clinical needs. A third incorrect approach is to apply excessive transducer pressure or force the patient into uncomfortable positions. This violates ethical principles of patient comfort and safety and could potentially cause harm, contravening the CAMET guidelines on patient care and professional conduct. Professional reasoning. Professionals facing this situation should employ a structured decision-making process. First, they must assess the degree of image degradation and identify the likely physical causes, e.g., attenuation, shadowing, poor interface. Second, they should systematically apply their knowledge of ultrasound physics to adjust technical factors and transducer techniques. Third, they should communicate effectively with the patient, explaining the need for specific positioning or adjustments and seeking their cooperation. If diagnostic images cannot be obtained despite these efforts, the technologist should document the challenges encountered and consult with a supervising physician or senior colleague to determine the next steps, which might include rescheduling the exam or considering alternative imaging modalities. This process ensures that patient care, diagnostic accuracy, and professional accountability are maintained. Question 15. The evaluation methodology shows that a medical radiation technologist is tasked with preparing a patient for an imaging procedure that utilizes strong magnetic fields and radiofrequency pulses to generate detailed anatomical images. Based on the fundamental properties of the energy sources involved in this procedure, which classification of radiation is primarily employed? Option A, thermal radiation. Option B, ionizing radiation. Option C, non-ionizing radiation. Option D, a combination of both ionizing and non-ionizing radiation. The correct answer is C, non-ionizing radiation. Explanation. Scenario analysis. This scenario presents a common challenge in medical radiation technology, where the technologist must differentiate between the fundamental properties of radiation types to ensure patient safety and diagnostic accuracy. The challenge lies in applying theoretical knowledge of ionizing and non-ionizing radiation to practical imaging scenarios, understanding the implications of each for biological tissues and imaging quality. Accurate identification is crucial for selecting appropriate equipment, protocols, and safety measures, directly impacting patient care and regulatory compliance. Correct approach analysis. The correct approach involves recognizing that magnetic resonance imaging, MRI, utilizes non-ionizing radiation in the form of radiofrequency, RF, waves, and magnetic fields. These energies interact with the body's water molecules to generate signals that are then processed into images. Unlike ionizing radiation, RF waves and magnetic fields do not have sufficient energy to directly remove electrons from atoms or molecules, thus not causing DNA damage or increasing cancer risk in the same manner. This understanding aligns with the principles of radiation safety and the specific regulatory guidelines governing the use of medical imaging technologies, as outlined by the Canadian Association of Medical Radiation Technologists, CAMT. The technologist's role is to ensure the safe and effective application of these technologies based on their fundamental physical properties. Incorrect approaches analysis. One incorrect approach would be to classify MRI as using ionizing radiation. This is a fundamental misunderstanding of the physics involved. Ionizing radiation, such as X-rays or gamma rays, possesses enough energy to ionize atoms and molecules, leading to potential cellular damage and increased stochastic health risks. Mistaking MRI for an ionizing radiation modality would lead to the application of inappropriate safety protocols and a misinformed approach to patient care, potentially causing undue anxiety or leading to incorrect equipment selection. This directly contravenes the CAMT emphasis on accurate knowledge of radiation types and their associated risks. Another incorrect approach would be to assume that all forms of electromagnetic radiation used in medical imaging carry the same biological risks. While both ionizing and non-ionizing radiation are forms of electromagnetic energy, their interaction with biological tissues differs significantly due to their energy levels. Non-ionizing radiation, like RF waves in MRI, primarily causes thermal effects at high intensities, whereas ionizing radiation's primary concern is its ability to cause DNA damage and mutations. Failing to distinguish these differences leads to a generalized and inaccurate understanding of radiation hazards, which is professionally unacceptable, and a failure to adhere to the principles of radiation protection as mandated by regulatory bodies. Professional reasoning. Professionals in medical radiation technology must employ a systematic decision-making process. This begins with a thorough understanding of the physical principles underlying each imaging modality. When presented with a scenario involving a specific imaging technique, the technologist should first identify the type of energy used. This identification should be based on established scientific principles and regulatory definitions. Subsequently, the technologist must recall the known biological interactions and associated risks of that specific type of radiation. Finally, they must apply this knowledge to select appropriate safety measures, imaging parameters, and patient communication strategies, ensuring compliance with CAMT guidelines and best practices for patient care. This process emphasizes critical thinking and the application of foundational knowledge to practical situations. Question 16. Governance review demonstrates a nuclear medicine technologist observes a discrepancy between the prescribed radiopharmaceutical dose and the actual dose drawn from the vial for a patient's diagnostic imaging procedure. The technologist also notes a slight variation in the patient's preparation compared to the standard protocol. What is the most appropriate course of action for the technologist to ensure best practice and patient safety? Option A. Administer a different, more readily available radiopharmaceutical that is commonly used for similar imaging, believing it will achieve a comparable diagnostic outcome. Option B. Document the discrepancy in the patient's record and proceed with the imaging as originally prescribed, without seeking further clarification or physician input. Option C. Proceed with the imaging using the drawn dose, assuming the variation is minor and will not significantly impact diagnostic quality, and document the observation. Option D. Consult with the supervising physician or nuclear medicine specialist to discuss the observed discrepancy and collaboratively determine the appropriate next steps. The correct answer is D. Consult with the supervising physician or nuclear medicine specialist to discuss the observed discrepancy and collaboratively determine the appropriate next steps. Explanation. Scenario analysis. This scenario presents a common challenge in nuclear medicine practice, ensuring patient safety and diagnostic accuracy when faced with a potential deviation from established protocols. The challenge lies in balancing the need for timely patient care with the imperative to adhere to regulatory requirements and best practices for radiation safety and image quality. A technologist must critically evaluate the situation, consider the potential risks and benefits of altering a procedure, and make a decision that upholds professional standards and patient well-being. This requires a deep understanding of nuclear medicine principles, including radiopharmaceutical handling, imaging protocols, and radiation protection, as well as an awareness of the governing regulatory framework. Correct approach analysis. The correct approach involves consulting with the supervising physician or nuclear medicine specialist to discuss the observed discrepancy and collaboratively determine the most appropriate course of action. This aligns with the Canadian Association of Medical Radiation Technologists, CAMET, Code of Ethics and Practice Standards, which emphasize the technologist's responsibility to provide safe and effective patient care, to practice within their scope of competence, and to consult with other healthcare professionals when necessary. Specifically, the CAMET practice standards for nuclear medicine technology would guide this decision-making process, highlighting the importance of adhering to approved protocols for radiopharmaceutical administration, patient preparation, and imaging acquisition to ensure diagnostic quality and minimize radiation exposure. Seeking expert guidance ensures that any deviation is justified, documented, and implemented in a manner that prioritizes patient safety and diagnostic integrity, thereby fulfilling the technologist's ethical and professional obligations. Incorrect approaches analysis. Proceeding with the imaging without any consultation, assuming the deviation is minor, represents a failure to adhere to established protocols and a disregard for potential impacts on image quality and radiation dose. This violates the CAMET practice standards that mandate adherence to approved procedures and the principle of ALARA, as low as reasonably achievable, for radiation protection. It also bypasses the physician's ultimate responsibility for patient diagnosis and treatment planning. Administering a different radiopharmaceutical than prescribed, even if perceived as a more readily available alternative, is a serious breach of protocol and patient safety. This constitutes practicing outside the scope of the technologist's authority and could lead to incorrect diagnoses, inappropriate treatment, and significant radiation hazards to the patient. This directly contravenes regulations regarding the safe and accurate use of radioactive materials and the CAMET Code of Ethics concerning patient safety and professional accountability. Documenting the deviation and proceeding with the original imaging protocol without seeking clarification or physician input is also problematic. While documentation is important, it does not absolve the technologist of the responsibility to ensure the protocol is appropriate and safe for the patient. This approach fails to proactively address a potential issue that could compromise diagnostic accuracy or patient safety, thereby not fully meeting the standards of professional judgment and patient advocacy expected by CAMET. Professional reasoning. Professionals facing such a situation should employ a structured decision-making process. First, identify the discrepancy and its potential implications for patient safety, diagnostic accuracy, and radiation protection. Second, consult relevant CAMET practice standards and institutional policies. Third, communicate the observation and concerns to the supervising physician or nuclear medicine specialist, providing all necessary details. Fourth, collaboratively determine the best course of action, ensuring it is documented. If immediate consultation is not possible, the technologist must prioritize patient safety, and if necessary, postpone the procedure until appropriate guidance can be obtained, always acting within their defined scope of practice and ethical obligations. Question 17. Compliance review shows that a routine quality assurance test for a digital radiography unit has flagged a minor but persistent artifact on test images. The technologist performing the test has confirmed the artifact is reproducible. What is the most appropriate immediate action according to the principles of quality assurance in medical imaging as practiced in Canada? Option A. Ignore the artifact as it is minor and unlikely to significantly impact diagnostic interpretation. Option B. Document the artifact in the QA logbook and plan to address it at the end of the shift when workflow is less demanding. Option C. Continue performing patient imaging as scheduled, but make a note in the patient's electronic health record about the artifact. Option D. Immediately cease patient imaging on the affected unit and report the anomaly to the medical physicist or designated QA personnel for investigation and resolution. Correct answer is D. Immediately cease patient imaging on the affected unit and report the anomaly to the medical physicist or designated QA personnel for investigation and resolution. Explanation. Scenario analysis. This scenario presents a common implementation challenge in quality assurance, within medical imaging departments. The challenge lies in balancing the need for rigorous adherence to QA protocols with the practical realities of daily workflow, staffing constraints, and the potential for equipment downtime. A technologist's immediate response to a detected anomaly requires careful judgment to ensure patient safety and diagnostic accuracy without causing undue disruption or compromising other essential services. The professional challenge is to identify the most effective and compliant course of action when a QA test indicates a potential issue. Correct approach analysis. The correct approach prioritizes patient safety and diagnostic integrity by immediately escalating the issue to the appropriate personnel. This aligns with the Canadian Association of Medical Radiation Technologists, CAMET, Code of Ethics and Professional Practice Guidelines, which emphasize the technologist's responsibility to report any factors that may compromise patient care or diagnostic quality. Prompt reporting to the medical physicist or designated QA personnel ensures that the issue is investigated and resolved efficiently, preventing the use of potentially compromised equipment for patient imaging. This proactive stance upholds the principles of quality assurance by addressing deviations from established standards promptly and systematically. Incorrect approaches analysis. Continuing to perform patient imaging without addressing the QA anomaly represents a significant failure in quality assurance and a breach of professional responsibility. This approach risks generating suboptimal images, leading to misdiagnosis or the need for repeat examinations, which is detrimental to patient care and resource utilization. It also violates the fundamental principles of QA, which are designed to prevent such occurrences. Delaying the reporting of the QA issue until the end of the shift or a more convenient time is also professionally unacceptable. QA is a continuous process, and any deviation from expected performance requires immediate attention. Postponing the report can lead to a prolonged period where compromised images are acquired, increasing the risk to patients and the workload for subsequent investigations and corrections. This demonstrates a lack of commitment to the principles of quality assurance and patient safety. Ignoring the QA alert altogether is the most egregious failure. This demonstrates a complete disregard for established protocols, professional standards, and the ethical obligation to ensure the quality of diagnostic imaging. Such an approach would have severe consequences for patient care and could lead to disciplinary action by regulatory bodies. Professional reasoning. Professionals in medical radiation technology must adopt a systematic decision-making process when encountering QA issues. This process involves 1. Recognizing and understanding the significance of the QA alert. 2. Immediately assessing the potential impact on patient safety and diagnostic image quality. 3. Consulting relevant protocols and guidelines, e.g., Departmental QA Manual, CAMET standards. 4. Promptly reporting the issue to the designated authority, e.g., Medical Physicist Supervisor. 5. Documenting the issue and the actions taken. 6. Following up to ensure the issue is resolved before resuming normal operations. This structured approach ensures that quality assurance is integrated into daily practice, safeguarding patient well-being and maintaining the integrity of diagnostic imaging services. Question 18. Implementation of a new MRI safety protocol requires technologist training on assessing patient implants. Which of the following actions best demonstrates adherence to best practices for patient safety when a patient presents with a known metallic implant? Option A. Proceed with the MRI scan after the patient states they have had the implant for many years and have never had issues. Option B. Immediately cancel the MRI appointment and refer the patient for a CT scan instead. Option C. Conduct a thorough pre-MRI screening, verify the specific type and manufacturer of the implant, and consult relevant MRI safety information to determine its compatibility and any necessary scanning conditions. Option D. Ask the patient to remove the implant before the MRI scan if possible. The correct answer is A. Proceed with the MRI scan after the patient states they have had the implant for many years and have never had issues. Explanation. Scenario analysis. This scenario presents a professional challenge due to the inherent risks associated with magnetic resonance imaging, MRI, and the critical need for patient safety. The presence of metallic implants in a patient undergoing MRI necessitates a thorough and systematic assessment to prevent potentially life-threatening complications. The technologist must balance the diagnostic benefits of MRI with the paramount duty to protect the patient from harm, requiring meticulous attention to detail and adherence to established safety protocols. This situation demands a high degree of clinical judgment and a deep understanding of MRI physics and its interaction with biological tissues and implanted devices. Correct approach analysis. The correct approach involves a comprehensive pre-MRI screening process that specifically addresses the presence of metallic implants. This includes detailed patient history, direct questioning about any implanted devices, and verification of implant compatibility with MRI. The technologist must consult the implant manufacturer's guidelines or the MRI safety officer to confirm the specific MRI safety status, e.g., Mr. Safe, Mr. Conditional, Mr. Unsafe, of the identified implant. If the implant is Mr. Conditional, specific conditions for safe scanning, e.g., field strength, gradient limits, specific absorption rate, must be strictly adhered to. This approach aligns with the Canadian Association of Medical Radiation Technologists, CAMET, Code of Ethics and Practice Standards, which emphasize patient safety, informed consent, and the technologist's responsibility to practice within their scope of knowledge and competence. It ensures that all potential risks are identified and mitigated before the scan commences, upholding the principle of do no harm. Incorrect approach is analysis. Proceeding with the MRI scan without verifying the safety of the metallic implant is a significant regulatory and ethical failure. This directly violates the CAMET commitment to patient safety and the technologist's duty of care. Relying solely on the patient's recollection or assuming an implant is safe without verification is negligent and could lead to severe adverse events, such as implant displacement, heating, or malfunction, causing injury or death. Ignoring the potential risks associated with metallic implants demonstrates a lack of due diligence and a failure to adhere to established MRI safety protocols, which are fundamental to responsible practice. Furthermore, failing to consult manufacturer guidelines or the MRI safety officer when an implant's safety is uncertain represents a breach of professional responsibility and a disregard for evidence-based safety practices. Professional reasoning. Professionals in medical radiation technology must adopt a proactive and systematic approach to patient safety, particularly in advanced imaging modalities like MRI. The decision-making process should always begin with a thorough risk assessment. This involves identifying potential hazards, evaluating their likelihood and severity, and implementing appropriate control measures. In the context of MRI and metallic implants, this translates to a rigorous screening protocol. Professionals should be trained to recognize potential contraindications and to know when and how to seek expert advice. A culture of safety, where questioning and verification are encouraged, is crucial. When faced with uncertainty, the guiding principle should always be to err on the side of caution and prioritize patient well-being above all else, ensuring that all actions are justifiable and aligned with regulatory requirements and ethical obligations. Question 19. The control framework reveals that patient undergoing radiation therapy for a pelvic malignancy presents with new onset of significant edema in the treatment area, which was not present during the initial simulation and planning. The radiation therapist observes this change and considers how to proceed with the next scheduled treatment. Which of the following represents the most appropriate and regulatory compliant course of action? Option A. Proceed with the scheduled treatment as planned, assuming the edema is a minor, transient issue that will not significantly impact dose delivery or patient outcome. Option B. Inform the patient that treatment will be postponed until the edema resolves without consulting the radiation oncologist. Option C. Consult with the radiation oncologist to discuss the observed edema, determine if a treatment plan modification is clinically indicated, and follow established protocols for plan changes and resimulation if necessary, ensuring all steps are thoroughly documented. Option D. Adjust the treatment field margins unilaterally based on the observed edema to account for potential tissue shifts, and proceed with the treatment without further consultation. The correct answer is C. Consult with the radiation oncologist to discuss the observed edema, determine if a treatment plan modification is clinically indicated, and follow established protocols for plan changes and resimulation if necessary, ensuring all steps are thoroughly documented. Explanation. Scenario analysis. This scenario presents a common challenge in radiation therapy treatment planning where a patient's clinical presentation evolves, necessitating a modification to the established treatment plan. The professional challenge lies in balancing the need for timely intervention to address the patient's changing condition with the imperative to adhere strictly to established protocols and regulatory requirements for treatment plan changes. Failure to follow proper procedures can compromise patient safety, treatment efficacy, and regulatory compliance. Correct approach analysis. The correct approach involves a comprehensive review of the patient's updated clinical information, consultation with the radiation oncologist to determine the necessity and nature of the plan modification, and meticulous documentation of all changes and justifications. This aligns with the Canadian Association of Medical Radiation Technologists, CAMET, Code of Ethics and Practice Standards, which emphasize patient safety, professional accountability, and the importance of evidence-based practice. Specifically, it upholds the principle of providing competent and ethical care by ensuring that any deviation from the initial plan is clinically justified, technically feasible, and approved by the responsible physician. The detailed documentation ensures transparency and facilitates quality assurance. Incorrect approaches analysis. One incorrect approach involves proceeding with the treatment modification based solely on the technologist's observation without formal physician consultation and approval. This violates the principle of physician oversight in radiation therapy, a fundamental regulatory requirement. The technologist is not authorized to independently alter a prescribed treatment plan. This failure constitutes a significant breach of professional responsibility and regulatory guidelines, potentially leading to incorrect dosimetry and adverse patient outcomes. Another incorrect approach is to delay the treatment modification indefinitely due to perceived administrative burdens or lack of immediate physician availability. This neglects the ethical and professional obligation to respond to changes in a patient's condition that may impact treatment efficacy or safety. Prolonged delays can compromise the therapeutic window and negatively affect patient prognosis, violating the principle of acting in the patient's best interest. A third incorrect approach is to implement the modification without proper documentation or verification of the new parameters. This creates a significant risk of error, as the treatment delivered may not accurately reflect the intended plan. It also hinders quality assurance processes and makes it impossible to trace the evolution of the treatment plan, which is a critical aspect of regulatory compliance and patient safety. Professional reasoning. Professionals should approach such situations by first recognizing the need for a change based on clinical observation or patient feedback. The next step is to immediately communicate these findings to the radiation oncologist. Following the oncologist's directive, the technologist must then ensure all necessary steps for plan modification, including resimulation if required, accurate data entry, and verification of new treatment parameters, are meticulously followed and documented. This systematic process ensures that patient care remains paramount while adhering to all regulatory and ethical standards. Question 20. Investigation of the introduction of a novel low-dose CT angiography protocol for peripheral vascular imaging. A technologist is tasked with its implementation. What approach best ensures patient safety, diagnostic efficacy, and compliance with CAMET standards? Option A. Immediately deploy the new protocol across all relevant CT scanners, relying solely on the vendor's provided training materials for technologist education. Option B. Introduce the protocol gradually, prioritizing speed of adoption over thorough technologist training and independent protocol verification. Option C. Implement the protocol without formal validation, assuming the vendor's specifications guarantee optimal performance and safety for all patient types. Option D. Conduct a pilot study with a small patient cohort, meticulously validating image quality against established diagnostic criteria and assessing radiation dose metrics, while simultaneously providing comprehensive, hands-on training and competency verification for all involved technologists. The correct answer is D. Conduct a pilot study with a small patient cohort, meticulously validating image quality against established diagnostic criteria and assessing radiation dose metrics, while simultaneously providing comprehensive, hands-on training and competency verification for all involved technologists. Explanation. This scenario presents a common implementation challenge in computed tomography, CT technology, balancing the need for advanced imaging capabilities with the practicalities of patient safety and workflow efficiency within a regulated environment. The challenge lies in integrating new protocols that offer improved diagnostic information while ensuring they align with established safety standards, technologist competency, and patient well-being, all under the purview of the Canadian Association of Medical Radiation Technologists, CAMET, guidelines and relevant provincial/territorial regulatory bodies. The correct approach prioritizes a systematic, evidence-based, and collaborative implementation strategy. This involves thorough protocol validation, technologist education and competency assessment, and clear communication channels. This aligns with best professional practice by upholding the CAMIC commitment to quality patient care, radiation safety, and the ongoing professional development of its members. It ensures that new technologies are adopted responsibly, minimizing risks and maximizing benefits, which is a core ethical and regulatory obligation for medical radiation technologists. Incorrect approaches fail to adequately address the multifaceted nature of implementing new CT technology. One incorrect approach might involve immediate widespread adoption without proper validation. This is professionally unacceptable, as it bypasses crucial steps in ensuring protocol efficacy and safety, potentially leading to suboptimal imaging, increased radiation dose to patients, and a failure to meet the standards of care expected under CAMIC guidelines. Another incorrect approach could be to rely solely on vendor-provided training, without independent verification of its adequacy or integration into the facility's specific workflow and patient population. This neglects the technologist's professional responsibility to critically evaluate and adapt training to their practice setting, potentially leading to errors and non-compliance with regulatory expectations for competent practice. A third incorrect approach might be to implement new protocols without involving the radiology team, including radiologists and physicists, in the validation process. This isolates the technologist and fails to leverage the expertise necessary for comprehensive protocol review, potentially overlooking critical diagnostic or safety considerations, and contravening the collaborative spirit of patient care mandated by professional standards. Professionals should employ a decision-making framework that begins with identifying the need for a new protocol or technology. This is followed by a thorough literature review and consultation with relevant stakeholders, radiologists, physicists, vendors. A pilot study or phased implementation with rigorous data collection and analysis is then crucial. Technologist competency must be assessed and addressed through targeted education and training, with ongoing quality assurance measures in place. Finally, clear documentation and communication of the new protocol and its implementation are essential for sustained compliance and best practice.